The wireless.
Psoriasis is a skin condition which affects up to 1.8 million people in the UK. As well as living with the physical symptoms, it can have a psychological effect on the people who have it. Joining us on the wireless from Age UK to tell us more is Helen McAteer from the Psoriasis Association. Hello, Helen.
Hello.
Toby Hadoke is a comedian who suffers from psoriasis.
Hello.
And Simon Lawton-Smith is the head of policy for the Mental Health Foundation.
Hello there.
Good to have you with us. Helen, first of all, can you tell us a bit more about what psoriasis actually is? Because I've got my sort of thoughts about what it is. It's obviously to do with your skin, isn't it?
It is a skin condition, yes, and it's basically the speeding up of the skin reproduction process. So regular skin is replaced every 28 days. For people with psoriasis, this is speeded up to between every 2 and 6 days.
So that sort of makes it a bit peely, flaky. That's what it is it?
Because the body can't quite keep up, it results in raised red areas of skin on the body that we call plaques. And on the top of those plaques, you can see a silvery scale. That's just the dead skin cells that are waiting for the body to get rid of.
And is it itchy?
Yes.
I'm going to talk to Toby in a minute about it, but is there a physical feeling to it? Or...
Psoriasis is itchy. Unfortunately, there was a myth for many years that psoriasis wasn't itchy, just eczema, another very common skin condition, is
and
itchy.
they're sort of different, aren't they? Obviously, yeah.
But as Toby will tell you better than myself, psoriasis can be very itchy, yeah.
Okay. Other side effects of the condition?
There are side effects of psoriasis. The one that is that we know most about is a form of arthritis called psoriatic arthritis. However, we know that psoriasis impacts greatly on people's psychological well-being and their quality of life. So around 20% of patients with severe psoriasis unfortunately have to take antidepressants. There are other side effects with psoriasis that the research is ongoing, looking into links with cardiovascular disease, for example.
This must be quite a heavy thing to have. I mean, Simon, you're from the Mental Health Foundation, you're head of policy for them. Why have you joined forces with the Psoriasis Association?
Well, we've been doing a lot of work around long-term conditions, so cancer, heart disease, psoriasis, and these physical conditions that people have, because it's not well enough understood that actually a lot of these conditions have a serious psychological component as well. Generally, if you're getting healthcare for a condition, staff will focus very much on the primary condition. What they don't realise is what we call comorbidity, which is that people will often experience mental health problems alongside the physical condition. And the fact is, unless those mental health problems are addressed as well, it can take much longer for people to recover from the physical condition or to learn to live with it.
Because I guess that they're thinking about it so much and that doesn't help them recover, I guess.
That doesn't help them recover. I think obviously having any physical health condition, and psoriasis can be very distressing for some people. It'll stop people leaving their homes, people won't want to go to work, so they lose their job as a result of it. All these things we know as psychological impact. And the good news is, of course, that there are treatments we can give, psychological therapies that people can have that get them back on track.
So Toby Hadoke is a comedian. You don't look any different to anyone else. You apparently have had psoriasis.
I've had psoriasis very badly. I don't look like any different to anybody else today. 6 months ago, I looked like the singing detective. So yes, I've had it for 25 years.
When did you first get it?
When I was 12, I had a streptococcal throat infection. And,
really?
Yeah, because we talk about it being a disease of the skin, it's also a problem with the immunity system. If you get a sore throat, your immune system arms itself and goes and sorts your throat out. Mine just goes, ah, and attacks everything and makes my skin reproduce too quickly.
And so how did it manifest itself for you? Was it on your face or what other areas of your body?
When I first got it, it was all over my body, fortunately, apart from my face. And then they got rid of it, and I had 2 little patches left on the side of that sprung up on the side of my nose, and they didn't go away for about 20 years. And even when I was completely free of it, these 2 stubborn bits stayed, not the back of my knee or my ankle. They went, no, let's be in the middle of your face. And but since I've been at the Royal Free Hospital, they got rid of that fairly quickly. But I have had outbreaks where it's sort of from the neck down.
And was it, obviously there was a treatment for the actual psoriasis itself, but did it affect you mentally as well? It must have been tough to deal with, especially if you're a performer.
Yeah, and there's been treatment for the psoriasis, but it's not necessarily always worked. I mean, for many years it was a lottery of different creams that maybe made it a bait, and then but only temporarily. And I've had light treatment, but no, especially when I had it on my face as well. But the psychological element is that you know that people. It's the first, if you meet somebody, you probably think, oh, I hope they like me, or I hope they think I'm dressed nicely, or I know that the first thing they see is the flaky wheels on my face, or if it's sunny and I think, well, I'll just roll my sleeves up. Oh no, I can't roll my sleeves up because people might see my arms, or skin might fall out and land on the chair, and somebody will see that and be disgusted by it.
So you've got to get over that mentally, haven't you?
Yeah.
Not just about putting the cream on.
It's not much of a chat-up line either. Do you want to come back to my place? But do bear in mind you will have to hoover yourself afterwards. So and I would like to point out that psoriasis sufferers, I will be moaning today because we're trying to raise awareness, but generally, I'm one of those people that if somebody says, how are you? I don't go, oh, I'm having a bad time. And there's actually part of the psychological profile of psoriasis sufferers, according to my expert doctor, is that we generally tend not to moan and suffer in silence. And that's, I think, where the psychological element comes to it, is because it's physically painful. So the concentration of just getting through the day without succumbing to the pain, and then the embarrassment factor on top of that, keeping up that front, if you like.
So you had
draining.
You had creams and things like that.
Yeah.
Worked a variety of creams.
Yeah, one you had to put on for 45 minutes and then wash off in the shower every day. The regime is messy. It's time consuming.
And are you keeping it away? Could it potentially come back? Because you look great now.
Do I look great? Well, that's the power of radio. I've got a creeping barrage coming up my arm as we speak, but that's a massive improvement from the fact that. But I'm being very aggressively treated at the moment because I was in hospital in May and I had a month off work.
Okay. Simon, what other treatments are available?
Well, the sort of treatments we'd look to address any psychological issues are things like cognitive behavioural therapy, which is where people with a trained cognitive behavioural therapist will actually rethink the way they think about their condition, think about how it impacts them and on their behaviour. And actually we do know that this has a very good success rate. It doesn't work for everybody all the time, but we do know, for example, that people who had to stop work because of a physical health condition, because they were feeling very low self-esteem, feeling very depressed, within 6 months perhaps course of psychological therapy, they are back at work. It does make a difference.
The question I want to ask, and it's a hard one, is it transmittable? So if I'm shaking your hand, am I going to get psoriasis?
No, you're not, but people think it is and people recoil. And I don't blame them. If I get up off a seat sometimes, I will have left I will have left a residue. I will have left detritus, and people look at you and think, "Oh, that's." But there's nothing I can do about that, and I can't carry a dustpan and brush around with me.
Well, you've come to terms with it very well, Toby, I have to say. Mentally, physically, in every way. Helen, where can we get more help, more advice about psoriasis?
For more help and advice about psoriasis, you can visit the Psoriasis Association website, which is www.psoriasis-association.org.uk. And we've partnered on this initiative with the Mental Health Foundation, and so you can visit their website too, which is www.mentalhealth.org.uk.
Thank you, Helen McAteer from the Psoriasis Association, also to Simon Lawton-Smith, Head of Policy from Mental Health Foundation, and comedian Toby Hadoke.